So welcome everybody to today's webinar. I'm Jordan Smoller, and along with Dr. Matthew Knock, I am co-director of the Center for Suicide Research and Prevention at Mass General Brigham and Harvard. And today's event is one in a series of webinars that our center hosts to highlight issues of importance regarding suicide and suicide prevention. And today's topic is certainly a timely and important one. Crisis services like 988 and crisis text line are designed to provide immediate confidential support for people experiencing suicidal thoughts, acute emotional distress, or other kinds of mental health crises, offering help at moments when access and timing and human connection matter most. Over the past several years, these services have undergone some really important transformations, including the launch of 988, we'll hear about, but also major challenges in terms of some uncertainty about their funding. At the same time, demand for crisis services has grown, reflecting both, I think, increased awareness and ongoing mental health burdens that we are seeing in the population today. So today's discussion is going to focus not just on what these services are, but also how they're evolving, where they're succeeding, where the critical gaps remain. And I am delighted to be joined by speakers with really deep expertise and leadership roles in these services, and to help us think about where crisis services are headed and what it's going to take to strengthen them going forward. So let me start with a few introductions of our panel. Dr. Tia Dole is the Chief 988 Suicide and Crisis Line Officer at Vibrant Emotional Health. Dr. Dole is a licensed clinical psychologist and longtime advocate for the rights of those with intersectional identity. Prior to becoming the Chief 988 Officer, Dr. Dole was Executive Director of the Steve Fund, the nation's only organization focused on mental health and emotional well-being for young people of color, and additionally was the Chief Clinical Operations Officer at the Trevor Project, the world's largest suicide prevention and crisis intervention organization for LGBTQ youth. Dr. Sha'iri Turner is the Chief Health Officer for Crisis Text Line and leads its public policy, advocacy, and crisis supervision teams. She's a trained internist and pediatrician with deep expertise in trauma-informed care, and brings both clinical insight and heartfelt commitment to her work at Crisis Text Line. She joined Crisis Text Line in 2017 as Chief Medical Officer, guiding the crisis supervision team and helping shape the care provided to people in crisis, and then returned in 2020 as Chief Transformation Officer, spearheading efforts to embed equity and inclusion in the organization's culture, and today as Chief Health Officer, she leads external initiatives that strengthen mental health policy, advocacy, and partnerships nationwide. And Casey Maitland is the Chief Clinical Officer at Samaritans, Inc. in Boston. Casey oversees all Samaritans' mental health support and suicide prevention programs, and first connected with Samaritans as a helpline volunteer many years ago. She has been practicing in the field of mental health, crisis intervention, and suicide prevention for more than 16 years, with experience in program development and strategic planning and policy implementation. And I'll just say, has been a great partner, as Samaritans has, with our center in developing new strategies to help people in need or in crisis. So it's a remarkable panel, and I think we should just dive right in and get the discussion going. And we're going to have a discussion among the panel, and then we're going to save some time at the end for folks to submit questions and have some questions from the audience, and have a chance for us to answer what we can. Okay, so let us get started. I'm going to start with you, Dr. Dole. If you could start us off with describing what crisis hotlines are and what is 988?
So, it's interesting. So, first of all, crisis hotlines have been around for many, many years. And what they are a resource for people who are in crisis or, frankly, in pre-crisis, to reach out to speak to a trained counselor. And so, what that means is when folks call us, within a few seconds, they connect to a counselor. And people, generally speaking, nowadays can call, they can chat, or they can text. And they interact with a counselor who's going to see how they're doing, figure out whether or not there is an actual emergency happening, and they have the ability to speak with someone about what's happening in their life, and then most importantly, connecting them to resources. So it's really about de-escalation. Helping the person feel better in the moment. And then subsequently, do you need a call back in 24 hours, or where do you live? And we're happy to connect you with local resources based on your needs. And so, crisis lines are, to me, this is my personal opinion because I run one, are sort of like the backbone of mental health crisis in this country. And it's like a resource that a lot of folks don't know about. So 988 is a federally funded program. Um, and right now we serve about 9 million people a year, who reach out to us every day, 24/7, and get connected to resources.
That is remarkable.
Mhm.
Um, Thank you for that. So we talk about crisis lines and hotlines. What's the difference between a hotline and a cold line? Is that a thing?
I tend to do like a hotline and a warm line. So a
Okay.
hotline is generally speaking, someone who is actually in a crisis. And so you are thinking about suicide or family members thinking about suicide. Have a lot of family members who reach out to us. Call us. A warm line, generally speaking, are for folks who are just kind of struggling. They're experiencing a lot of anxiety, and there are a lot of different warm lines based on identity. So, for instance, you and I have a warm line for someone who is struggling with an eating disorder, or a warm line based on substance abuse. So you have a lot of specific warm lines. I will say, I always put a plug in. You don't need to wait till you're in crisis to call 988 specifically, or even reaching out to crisis text line. We actually love when people reach out to us when they are not in crisis,
Mm.
because we consider it a prevention. Yes.
Yes, great point. And you raised some of the specific issues that you deal with at 988. And we're going to be talking in this webinar about some real crises and mental health challenges that people face, including self-harm and suicide. So I just want to make a point to the audience that, if this is something that is very difficult or challenging to engage with right now, to, be aware and take care of yourself. And because we will continue to talk about some of these really challenging issues. So thank you for that introduction. I want to turn to Dr. Turner. You work with Crisis Text Line.
I do.
Can you tell us a little bit more about that? What is Crisis Text Line? How is it a resource for people?
Right. Thank you. So thank you for having me and for setting this up. Crisis Text Line is a national nonprofit, and we provide free 24/7 mental health support and crisis intervention by text, WhatsApp, and web chat. So solely text-based in English and in Spanish. Now, we've actually been around for 13 years. So we were one of the
Mm,
first organizations that provided national text support, in the same manner in which Dr. Dole described the de-escalation process, the help with all sorts of mental health and crises for individuals. We're a volunteer run organization, meaning that we've trained over 85,000 live volunteers on our platform. They take a 15-hour self-paced training and do some simulated practices, and then they are the people who receive the texters on the platform, and then they are supervised by our large and very well qualified mental health professionals who see every conversation simultaneously with the volunteer. We find that over 70% of our texters are under the age of 24, and over 50% identify as LGBTQ plus. and we over-index for communities of color. So we really feel like we reach out into communities and provide that in the moment, safe, confidential support that is really, again, like Dr. Dole mentioned, the backbone. We're part of that crisis continuum. We say a crisis to you is a crisis to us, which means we can see 13-year-olds, 10-year-olds who are dealing with homework issues or bullying, all the way through to those individuals who are having suicidal ideations or are actively suicidal. We serve, our volunteers are trained to de-escalate every conversation and then actually provide a resource at the end if we determine that the conversation is not imminent risk for suicide. We have anyone can text hello or Ayuda to 741-741 to reach us, but we are also operating a line that supports 988. So we have a separate service that's part of the National 988 Lifeline Backup Center, and we take English, we take text and chat in English and in Spanish. So we've been a part and a support for the 988 service since its inception.
Mm. Fantastic. And you touched on the remarkable volunteer effort that goes into this work, both for 988, for Crisis Text Line, and people who really are continuing to give of their time to volunteer in this way and to get the training and to be there for people is pretty remarkable. On that note, I want to turn to Casey Maitland because you're working on the ground at Samaritans of Boston, which is a 988 crisis line here. You've been involved in a lot of local programs and supervising and working with the volunteers on the front lines. Can you tell us a little bit more about who is answering the calls and how does it actually work when somebody reaches out to Samaritans, for example?
Yeah. Thank you so much. Good morning, everyone, and thanks for having me here. It's really an honor. I want to start a little bit by saying that, much like the work that the other lines are doing, Samaritans has also been in the game for quite some time, right? We started in 1974. We were the first Samaritans organization in the United States. 1974 in the basement of a church with 22 rotary phones. So we've come quite a long way, and the continuum has come quite a long way. And I think just to echo again, and I hope that's what the one thing that people take away, that this is the backbone, not only I think of the crisis care continuum, but really of good mental health care, which is the active listening, the being there for people in their moments. And I think, to sort of describe what it's like directly on the front lines is, when you're operating, and I think everyone would agree, a 24/7 crisis line, you don't ever quite know what's going to come in on the other end of that line. And I would say 100% of the time, people want compassionate, active listening. Right. Regardless, right. I loved what you said, Dr. Turner, about the sort of idea that whatever the crisis is, it's our crisis too, right? This idea that people go through things and that they're important to them, so they're important to us as well. So I think that it, much like dealing with any crisis, you don't know what's going to come in on the other end of the line, but this idea that the practice is the same, the response is the same, engaging with people in a way that is compassionate and caring and befriending is sort of our sort of signature, I don't know, I was going to say move, but that's not really the right word for it. The active listening in, being there for someone in the moment. And so I think the folks who are on the front lines, as everyone has said, and especially at Samaritans, are extensively trained individuals guided under the principles and practices of 988, right, which are put together through best practices from all around the world and guided by feedback from our callers. So Samaritans has built upon our expertise in this field, added to it with 988, and people go through this really sort of extensive training. And so those are the caring, compassionate folks who, one, volunteer their time or they're hired to do so to answer the calls from people who are interested in talking to us every day.
Hmm. Yeah, perfect. Thank you. So I think all of you sort of touched on this question of when should somebody think about calling? And uh, I think it was Dr. Dole maybe mentioned that, it's not necessarily when you are only in a crisis and have no other place to turn, but as a way of potentially, heading off a crisis or just getting support when you need it. So what would you say? I'll ask you, Dr. Dole, what would you say about who should reach out and when and what are the parameters that you see, if any, about using these services?
Well, I think Dr. Turner's statement is fantastic as well. So I'll say, if you're thinking about calling, call. Um, I think that if you are really struggling in the moment, and no matter who you are, what your identity, what your age is, please just reach out. And I think we don't determine whether or not something is a crisis, the individual does. And it really is easier to help someone when they are not standing on a bridge, literally or figuratively, right? And so for us, we want those people to reach out, but we also really encourage family members to reach out. We have a lot of parents who say, my loved one or my young person is as their behavior has changed. What do I do here? We really see ourselves as a way to prevent people from ending up injured or dying. Just to be perfectly frank, and in the past, crisis lines would be like, well, we only want to work with people who are actively suicidal. We want those people to call us 100%, but waiting into the last minute, into that moment, does not predict the best outcome. And so we really feel the federal government feels this way as well, is that we're a resource for people who are struggling with substance abuse. We're a resource for people struggling with mental health, with anxiety, with even homework help.
Mhm.
It has happened. We've had people as young as 5 years old who've reached out to us.
Yeah.
We want anybody who thinks about needing help to call us, because it is truly, we're in the middle of a suicidal crisis in this country, right? So, on average, about 50,000 people die by suicide a year. And that's just the people that we know for sure. That doesn't include, drug overdoses that are kind of, ambiguous, right? And so I know that these numbers have gone up every year, and I know especially with young people, which is my favorite group to work with, they are struggling, and so we don't want people to wait.
Yeah. So actually on that topic, and maybe I'll turn to Dr. Turner to ask, what have you seen in recent years? Dr. Dole just mentioned the sort of growing concern about suicide and sort of a mental health crisis in the country. Are you seeing, and how much are you seeing more engagement with these services over the past years?
Yes.
And what do you think that's about?
So we handle over 3,800 calls or texts per day,
Mm.
and that averages out to about 1.3 to 1.4 million texts or chats per year. We have at the end, after a conversation is de-escalated, we offer the texter the opportunity to engage in a survey that is completely anonymous, confidential, but aggregates the information. So demographics, the topic of the conversation, gives a rich corpus of data that we have been able to analyze over the course of
Mm.
the decade now, over the course of the decade. And what we found are people are texting in about relationships. Sort of every year, there's about the same five or six relationships, loneliness, isolation, depression, anxiety, bullying. So it was very interesting and worrisome, right? So we saw a dip in bullying during the pandemic because students were not together in school. And then after the pandemic, year over year, we've seen increases in conversations about bullying. So we see suicidal ideations, but we also note, communities of color are deeply impacted by at risk and with rising rates of suicide amongst our young people of color. And to be able to have a resource like Crisis Text Line or 988 where they can text or chat, because that's their space, right? Many of these young people are digital natives and they are not comfortable. They do not want to pick up the phone and talk to someone. They want to be able to do what they're always doing and receive the support that they need. So year over year, we're seeing those issues increase. We're seeing, we're right now working on some data around men and boys, but we're really able to get granular and see what are the topics, where are people reaching out, gun violence, school shootings, things like that will produce a spike, because we have our data really in the moment and can see what what the topics of conversations might be.
Mm-hmm. Um, Let me ask a little bit more about how you handle all of this, and in particular the training. I mean, we mentioned all of you that the folks on the other end here are, go through trainings, but you never really know what you're going to be facing. Um, can you give us a little insight into what kind of training, since these are mostly volunteers, these folks get? Casey, do you want to take that?
Yeah, yeah. And I want to dovetail too off of what Dr. Turner said, and it goes into this training piece, which is part of what we were also seeing was youth reaching out over and over again and not by phone, right? I mean, they just don't use that space anymore. And so in 2022, we created a youth peer-to-peer text line called Hey Sam. And so one thing I think, so it's run by people who are the ages of 15 to 24, answering texts for people the ages of 15 to 24. We really felt like that peer aspect was critically important. And certainly locally, we've answered over 12,000 texts since its inception. And in the first year and a half, we had 100% de-escalation rate. So we know, right, that the principles and practices that we're training folks on, which are based on the principles and practices that I'm going to talk to you about from 988, right, are the same. I think that there's a really common misconception that people have to have years and years of clinical training to do this work, and it's just not the case. I think that what an individual has to possess, and we talk about this all the time, is the openness and the willingness to not fix directly people's problems, but again, be there for them in the moment. Another sort of misconception is that, centers are sort of all on their own in deciding how to train people, and that's not also the case either. To be a 988 center, you have to be an accredited center, so you have to be accredited by bodies that are approved, right? And that process for all of us who have gone through that is very intense, and you have to show exactly what you're training, how you're training it, how you're supporting your staff and your volunteers, as well as how you're quality assuring what you're doing, right? So not only are you training your staff and you're making sure that they're following the principles and practices of how to befriend, how to assess for suicide, how to follow up, but then are they actually doing that and doing it over time? And then there's a lot of continuing education requirements. And again, 988 and the creation of 988 has brought so much incredible educational opportunities for centers to be able to access, really a database of information that all centers have equal access to. So it is intense in the beginning, certainly at least at Samaritans, based on a lot of our foundational information, plus the requirements that 988 brings, plus requirements that the state of Massachusetts brings. We're really looking at around a 2-month training from start to finish. And then there's a lot of practice that has to happen, right? Because people need to know what it's like and they need to be observed by people who've done this work, as well as, again, the continuing education and the ongoing quality assurance.
Yeah.
So
Yeah,
it's
that's
intense, but
remarkable.
necessary.
And so it's very a lot of training and presumably a lot of ongoing supervision, right? Actually, so Dr. Dole, can you address that as well from the national level, how
Yeah.
you develop this kind of infrastructure to train, supervise, and do this incredible work across the country.
Well, I will say, nationally, there are about 210 centers that are answering calls, chats, and texts. And just as a side note, most of the people answering calls, chat, texts are not volunteers. Generally speaking, most crisis centers use paid crisis counselors, and depending on the state, some states have master's levels. Crisis counselors, most states don't have that requirement. And I will say, just as a side note, the best crisis counselor isn't necessarily based on degree, it's based on temperament. So realistically speaking, sometimes clinicians aren't the best ones. The best crisis counselors are people who are able to be in the moment and frankly, be able to let it go at the end of the shift, because it is pretty intense. So across the country, to Casey's point, there each crisis center in the network is accredited. So they are required to maintain certain standards. And then to be in the 988 network, we offer trainings. We offer ongoing training, but we also offer things when things happen in the moment, right? Let's say there's an emergency or there is something happening. We will offer sort of like a synchronous, a live training to all crisis counselors across the network. This thing is happening. This is what you need to know right now in the moment. And so it is a pretty significant coordination. But it's exciting because the crisis centers in our network are so incredible. But each one is different because they're local, right? What we want is local centers to answer people who answer calls for their neighbors, because they are the ones with the best information. And so it is a kind of exciting to think about how each state has their own vibe.
Mm. Mhm.
And some states, their centers are really focused on farming. Some states are really focused on a more urban environment. It depends. We have the state of Washington has Native and Strong. So they are serving their indigenous community specifically.
Mm.
I think as time goes on, states are going to focus on their populations that need the most help. And I think that's the beauty of having a national network where states are able to really focus on what's most important to them. So the training is fantastic. And I think to your point, the crisis counselor is a generalist, so they never know what they're going to get, but they are able to help everyone. And if the person needs more, they will connect them.
And what do we know about the effectiveness of these kinds of services? I mean, are there
Oh,
data?
since I'm off mute, I'll just jump right in.
Yeah,
So
yeah, go for it.
there was a recent study, actually conducted by Columbia University, for folks who were in crisis, who were suicidal. 88% said that it stopped them from making a suicide attempt.
Wow.
And then 98% of people who've used the line, which it seems like a wildly high number, has said it was helpful to them. And so essentially, most people who use the line find it helpful and it de-escalates people who use it.
Wow. Yeah. Should we worry about the capacity to, I mean, are you all stretched in terms of the capacity that you have? Because as we talked about the mental health crisis that we talk about in the country doesn't seem to be subsiding, and people are becoming more and more aware of these important services.
Yes.
Are we worried
We
about that?
should be
Yeah,
worried.
we are worried.
No, I think I like to be very frank. This is a fantastic federal program, but states actually have to start to invest more into their crisis continuum, into their crisis centers. And some states are, and some states aren't. But I think as awareness of crisis lines increase over time, we do see people reaching out to us, and it's a really good thing because it's preventing death. And on top of it, we do need to see more investment. I can speak for the Trump administration has not got any funding for 988, knock on wood.
Mhm.
But the original 988 bill was signed under the first Trump administration. The current administration believes in this program and its value. which I think says a lot.
That's good to hear. Yeah. Um, I want to ask each of you actually, sort of what you thinking about the future and the current challenges, sort of what are what would you like to see happen in the next 5 years in terms of these services, uh, how they might be either sustained or integrated into some larger care, continuum of care kind of system? And what are your concerns? Where are the challenges that perhaps each of you see? Um,
I can,
yeah, Dr.
yeah,
Turner,
I
maybe
can
start
start.
with you.
As Dr. Dole mentioned, similar to 911, right? When 911 first started, it was a large federal initiative that was now decentralized to each state. So what is going to be critical in the upcoming years is for states to step up, to develop the infrastructure, to develop the funding streams, whether they're trust funds, whether they're, taxes, they have to be able to support that infrastructure within their own state for their own individual constituents and people. And the variation right now across states is tremendous in terms of even awareness of 988 at the state legislature level. I live in Florida. It's going to be very different here than, say, in California or in other states. So there first needs to be like a level setting across the state so that they understand that it is not going to remain a federal program indefinitely. There will always most likely be some federal support, but that states have to know their population, know what their population needs, and develop that infrastructure from, the call, text, and chat centers through to mobile crisis teams and mobile crisis units and connecting people to community-based care. So my hope and really where I hope this does go is that we move away from reliance on law enforcement, and move towards a real growth and establishment of mobile crisis units and mobile crisis teams that can come to people and bring the expertise that is needed for someone who's at imminent risk of suicide, so that the people who arrive at their door have a set of tools that are appropriate to a mental health situation, always appropriate for a mental
Mhm.
health situation. Our mental health crisis is not going anywhere. Young people, we have to focus and target our energy on helping our young people who are just crying out in need post-pandemic, especially. So the state, my hope, dream, desire, ambition is that the states each, you know, take charge of their funding and ensure that the crisis continuum is available and accessible to everyone within their state.
Yeah. Dr. Dole, how about you? Same question. What do you think, or where would you like to see this evolve to, and what are the challenges?
I think that I agree 100% with Dr. Turner. I think mobile crisis is the key. And I know the Samaritans, for instance, like you all are very keen on people having choice about what happens when they're in the middle of a crisis, which I think you should talk about a little bit if you're willing. I think realistically speaking, um, there is a crisis of not only a mental health crisis, but also there aren't enough clinicians. They're just not. There's the pipeline for folks to become mental health provider. You know, I want to become a social worker, but actually now officially, I can't even now get a student loan
Hmm.
to cover all of my tuition, which means that we're going to see even fewer social workers. And if I'm going to graduate with $70,000 in student loan and make $50,000, that math is not mathing, to quote young people. So I do think that we are going to have to shift to a couple of things. Number one, I do think crisis lines will play a bigger role. Some people use us as their mental health service. It's just a fact, especially in rural areas where they don't have access to, the clinician or they don't have health insurance. So I think based on the trends that I'm seeing, frankly, the need for crisis lines will increase, not decrease. Number two, I do think mobile crisis teams are key. I don't like police going into people's homes when they're in the middle of a crisis. It's a bad situation for everyone. Police are not social workers. There are peace agents. So that doesn't make sense to me. And then number three, I do think that we are going to have to think about mental health in non-traditional areas. I think that we're going to have to rely on faith-based folks. I think we're going to have to rely on schools more to be able to serve people who are more in crisis. And so I don't know, that's not particularly hopeful, but I do like to live in reality, which is that crisis lines will be needed more than ever from my perspective 5 years from now, especially given what's happening in insurance.
Yeah. So I do want to ask Casey, from your perspective on the ground, sort of what do you think where things should go and what the challenges are? And also, either you can address this first or after this issue that comes up about what happens when somebody is in a crisis and might need intervention. Dr. Dole was just mentioning the idea of choice and the concern that people may sometimes have that if I call, I'm going to end up having the police come to my house or something, and I don't want that, or I'm going to end up being forced to do something I don't want. So those are maybe two separate questions.
Yeah.
Maybe start with that one because that's
Yeah.
a one that I think does sometimes come up and may inhibit people from calling.
Yeah. And I think they're all connected in many ways, right? Or at
Yeah.
least in my head, they're connected and connect to my second answer. Um, you know, to speak to this, the Samaritans certainly, and I think this is what Dr. Dole is getting to, right? Samaritans certainly for many, many years really focused on a person's choice to be able to engage in a service or not, engage in, if they were at imminent risk, engage in police intervention or not. I think with the advancements of best practices of suicide prevention and that shifted a bit, but the sentiment never changed. And what I mean by that is that less than 2% of the time are we activating emergency services. And that's after many, many opportunities to engage with someone around what is the best fit for you. And so when someone is truly at imminent risk and not able to safety plan or not able to engage in some other type of help, we will call someone else for you. We will engage someone else. We will call an emergency service for you, etc. That's when we're engaging emergency services. And again, I think it connects to this idea that unfortunately, it's the only lever we have to pull because that's how the system currently works. So when we think about this larger continuum of care and everything that Dr. Turner and Dr. Dole are talking about, which is leaning more on mobile crisis teams, looking at what states themselves need and their populations need specifically is really important. I mean, even in as small of a state as Massachusetts, sometimes what's happening in Boston is different than what's happening in Springfield. And, you know, when you look at us, we're not that big on the map. And so that's happening nationwide, right? I mean, there are states that have things more organized than others. And I think that the stigma around mental health is so strong that it is hard to weave through these systems in a really clear way. Certainly for any of us who are providers, it is difficult, let alone for someone who's trying to access the service. And as providers, we hear that time and time again. I don't even know where to go. And so I think to this idea of like, what is the 5 years from now for me? And Dr. Dole, you touched on this in the beginning, which is not enough people know even that this exists still, right? So you're hearing the numbers, 9 million people. I mean, we have, you know, just our center in Boston, more than 103,000 calls and texts last year. And yet the thing we hear the most is, oh, I didn't know that existed. I didn't know you guys existed. You know, in the 988 and Hey Sam, in our legacy lines that we have when we were the 52-year-old center, right? We still have a number from there that we still get calls on today, is a facet of what Samaritans in Boston does. You know, we also run a survivor of suicide attempt support group based on the model of D.D. Hirsch Center in California. And one of the pieces of this 8-week closed group is for the suicide attempt survivors to call 988, to practice that. In the amount of times that we hear from suicide attempt survivors, I've never done this before. And I can't believe how helpful it was. I can't tell you. I mean, every time we have a session, and it's so surprising, right? That they don't know the number exists, they've never tried it, and that, you know, we get to help them practice through that. But I think for me, the 5 years from now would be all the things, right? And that more people know that these services exist because the stigma has lessened even just a little bit.
Yeah, I hope today's event will increase awareness as well, because you pointed out that, you know, it's not simply for the moment, the call of last resort, or the moment of most intense crisis, but you know, the idea of calling or contacting these services just to see what's available and to see what's there and to practice, you know, if you were to need it in the future, can be a step towards prevention. What about family members who are concerned about somebody's risk? Is that a situation that you encounter, and is that an appropriate use for the service?
Yes.
I would
So,
say, yeah, yes,
Yeah.
definitely.
go ahead, Casey.
I mean, just to say, we encourage people all the time, right, to call and talk about whether, you know, their loved ones and what they might be concerned about, right? Because the counselors can help them as well. So yes, absolutely, it's for those folks too.
We encourage, right? So anyone can, when we talk about crisis text line, we say, you know, save it into your phone, both for yourself, or if you are with someone. We talk about, we have part of our training is always ask, which lets people know that if you notice something about a person you care about, a friend, a family member that doesn't seem right, you don't have to be a therapist to ask if they have thoughts of death or dying or harming themselves. You can sit there and in a clear, kind way bring that topic up. And sometimes that can be so helpful to someone who's sitting in darkness and loneliness and does not know how to broach that subject, that you can do that as a regular individual. And if you have crisis text line or 988 in your phone, you can pull it up and, like Casey said, right, sit there together and do that. We have situations where there are third parties where people are texting or chatting about someone that they know. We always encourage them to share the number so that the person who is in crisis can get the direct support, as opposed to, you know, a bifurcated, triangulated support. But yes, like crisis text line 988 are resources that everyone should have in their phone for either themselves, or you never know when, you know, you're with someone in crisis and you don't want to be, no, what was that number? Right? Like, no, crisis, you have 988, you have crisis text line. In that moment, you never know when you might need it.
And I suspect clinicians probably aren't as aware of it as they might be. In other words, to provide it as a resource to those that they're caring for, if a crisis occurs and, you know, somebody wants to speak anonymously to somebody else. Do you find that? And what is the relationship with sort of clinical providers, if any, that the services have? Dr. Dole, you want to?
I could jump in.
Yeah.
You know, I think it's a bit of a crapshoot. You know, some clinicians know about us, some don't. I think we've had clinicians call us in the room with the client, which I always think is interesting. I think that, you know, what the best use of it, if you are a clinician, is really, you know, if this is after hours, and most clinicians are working 9 to 5, Monday through Friday. Unfortunately, where we see a lot of crisis happen seems to be somewhere between 11 and midnight. And we are there, right? All of us are here. And I do think that having clinicians say, like, hey, listen, if you're really struggling at night in between sessions, you can call 988, or you can call Crisis Text Line, or you can call Samaritans. I think it's really important to use as a resource, especially in between sessions, for de-escalation. And folks do find it incredibly helpful, because sometimes you can't wait for that next session. And so we do like clinicians to recommend us for their clients in between sessions, 100%. And, I think what's important for folks to know, and it's important that everybody knows that, is that depending on where you live, if you call 988 and you are in a crisis, right, there is an imminent risk. There is a possibility that police can't show up at your door. I
Mhm.
always say this, I like it to be very obvious, because that can be a scary experience, especially if you have an intersectional identity. And that is a possibility. That happens in a teeny tiny percentage, just like 1% are imminent risk, and end up with an intervention, not necessarily police intervention, but it's something that can happen.
Yeah.
I would also,
Yeah.
just on that note, like to say that we are here for clinicians as well, because I
Mm.
think there's an even deeper stigma for mental health professionals, for physicians, for anyone who is in that highly trained professional space, that they cannot need help, when in fact we're looking at incredible suicide rates for physicians, right? And where there's a feeling that there's nowhere to turn because you're expected to be the healer. So I always like to make note that, we are confidential. 988, 741, 741, both are confidential services and should be a place of support for clinicians, especially.
That's such an important point, and you're absolutely right. I mean, clinicians suffer crises themselves, have experienced some of these, life-threatening episodes, and there is a lot of stigma, uh, as there are for too many people in general. Um, we also have a little bit of information for those people who might want to get involved themselves in this. I think there's a slide. Uh, and we're going to be sharing information at the end. This might be a resource guide that will go out in a handout, but that it'll have information about how to contact the service. And if you wanted to get involved yourself as somebody who might serve as a crisis counselor, how to do that as well. So we will be sharing this handout. You've got the slide up there. Let's just go back because I know we're, as I suspected would happen, there's so much to talk about, but so little time. Let's go to a Q&A from the audience. I think we have gotten a bunch of questions already, and let me see if I can pull some of these up. One question was particularly about what you encounter with older adults, especially men over the age of 75, which is actually a pretty high risk group for suicide. Um, any comments on that from anybody on the panel?
As I said, the crisis counselors are generalists. The issue with older adults, especially men, and I will say two populations that we've identified at high risk are people obviously over the age of 75 and actually middle-aged white men in the 50s, 60 range. The biggest issue is number one, that they don't know about the service, and number two, stigma.
Mm.
So they don't know about the service, and when they do know about the service, they don't feel like they should have to use it. They feel embarrassed to use it. And I think what we've seen on a local level, which I really enjoy, are campaigns directed towards their population. Like my favorite campaign is in Louisiana, and they had like these billboards that said like feeling swamped,
Mm.
call 988, which I think is very humorous, or like sort of like very targeted ads towards their different populations. And I think that actually really is the key. We have something called 988 Day. We had our second annual. And during our 988 Day, we had over 9 billion impressions, meaning that 9 billion people were exposed to the concept of 988, which we're really excited about. However, people over 75 are not really on social media. So what we really have to focus on, and we've done it in the past, and we have another campaign probably coming up soon, is how do we find those people? Where are those people? How do we let them know? Are they in churches? Are they in synagogues? Are they, going to cooling centers in the summer? We have to let them know that it's here and that it's okay for them to reach out to us and what to expect. Because some people dial and then they hang up before someone answers because they don't know what to expect. And that can be extremely stressful, especially if it's your first time at 75.
Yeah.
I'll just
Yeah,
oh,
go
I'll
ahead.
just jump in to add to that to say that I think that a lot of the work with folks who are over the age of 75, and just to echo, is local work, right? Because it's about going to them rather than thinking that they're going to come and find someone else. And like I said, Samaritans does a lot of other things, including 988. And one of the things that we're doing right now is working with the Boston Public Health Commission to train both providers who serve older adults as well as older adults on basic suicide prevention concepts. As well as here are the numbers that you can access at any time, any place. And what we're finding is too that we're getting a lot of asks for training in other languages, because many of the older adults who live in Boston speak different languages as their first language, and so how can we make materials even more accessible to them? But I do think a lot of that work is going to be, will happen additionally, other than awareness, which is incredibly important, is finding where those people are. Again, this sort of idea of there's all this stuff going on federally and across the nation, and where can we then bring it down to the local level?
Yeah. Well, that national local or structure is remarkable. I mean, if people are calling 988, how are they getting routed to local versus and how does that work? How does the call get handled when it comes in as a 988 or even a text?
Yeah. So my organization, I work for Vibrant Emotional Health, handles the telephony.
Mm,
And so let's say if I'm making a phone call, I am geo routed based on the nearest cell phone tower. So whatever cell phone tower is closest to the local call center, that is where I'm routed. If that call center doesn't have the ability to answer because they don't have the capacity, then you go to a backup center,
mm,
which is probably most likely not in state. And so for calls, that's how things are routed right now. Texts are routed via area code. So, I believe Boston 617, as having grown up there, right? 617, you're going to go to your local call center. But the thing that doesn't work very well is if I've moved to California with my 617, I'm still
mm,
going to go to Boston. And so over the summer, the FCC has done a notice of rulemaking, which requires cell phone providers to offer geo routing for text. And so what we'll find within the next 9 months, is that if you text from with your 617, but you are in California, you'll go to D Hirsch or some other call center out there. And then for chat, people are routed based on the area code that they put in.
mhm.
And I
Fascinating.
think,
Yeah.
another thing, a rule of thumb, right, when we talk about clinicians who are trying to help people or get them to the right place, you that's a quick Google search, right, to find out where those local centers are, or even on 988. All that information is there, right? Who the centers are, if they're trying to get someone directly connected to something that is local.
Yeah. Okay, so let's see. I think we've addressed a whole bunch of questions. Again, we're going to have a handout among the resources that we can share after that will have some of this information and contacts and things like that. Maybe in just the remaining time, we'll go around one more time and I'll ask you, so what if people were to take away something uh, well, actually, before we get to that, we have time probably to squeeze in one more. We just got another question about what have you seen regarding people living with chronic disabilities and chronic illness? Um, uh, just very briefly, is
Yeah.
that something you're seeing increasingly?
So
Karen?
um, I don't have statistics really on the data around chronic illnesses or chronic disabilities from crisis text lines perspective. But we know the connection between chronic illnesses and chronic disabilities and mental health issues and the strain both on the individual themselves and their network of caretakers, caregivers. So I think we are here, right? So again, it's a service that's general and available both for those who have chronic illnesses and those who I would again flag those who care for people who have
Mm.
chronic illnesses and disabilities.
Yeah. So I
But
think what comes through in all of this is you're there for everybody, right?
yes,
And there are communities that have maybe not had as much exposure to the awareness that
right.
this service is there, but that you welcome and want to hear from everybody. So we have like 3 minutes left. So I do want to wrap up with just a minute, maybe from each of you about, what are key takeaways or things that you really want people to know about these issues and the services that you represent. So maybe we'll just start quickly with Dr. Dole.
If you or a loved one think about 988, that you might need some help, call. Don't hesitate. And you can hang up on us. You can reach out as many times as you want. Whatever it is that is helpful to you. And also, not for nothing, post in your social network. We find
Mm,
that like if you have like a little 988 sign and you post it, you actually people just knowing about it, research has shown that that helps them.
mm,
Knowing that it's there actually de-escalates them, even without reaching out to us. So please don't hesitate. And I think the biggest issue is that people are like, well, my issue is not that important. We know that you're important. We know that your family members are important. We want to help. We want to be here.
beautiful. And what you just mentioned is really important. That is, even if you weren't to get involved as a volunteer, you can be part of helping this along by spreading the word that these things are available, right? Dr. Turner.
Yes, I would double click on that and say a crisis to you is a crisis to us. Meaning it doesn't matter what your crisis is, no one is gatekeeping. Everyone has access to the service. Number two is always ask. So know that you as an individual are
Mm,
part of the crisis continuum, whether it's supporting someone, asking a friend, sitting there with someone and having them um, dial or text 741 or text 988. Just being there and supporting can you never cause someone to want to kill themselves or die by suicide if you ask them if they're having those thoughts. And the last thing is our volunteer training is 10 to 15 hours self-paced, and our volunteers find that by doing the training, they actually increase their own resilience, their own ability to de-escalate situations in their homes, in their communities. So it has a ripple effect. So I encourage anyone who wants to please come and do the volunteer training at Crisis Text Line, crisistextline.org.
thank you. And Casey, I'm going to give you the last word on this. We're running up against the time,
Up
so
against time.
yeah.
Okay, so what I will say, I will quote QPR and say that suicide prevention is everybody's business, right? So anything that you can do, share the line, put it in your phone, go to a website is very important. And just know that you're not alone in any of this, that there are people here willing and ready and able to meet you where you're at. The only other thing I'll say too, in the chat, it says this about, what do you do if you want to know about the service? If you're a clinician, call, text, find out yourself, and then you can tell people about it.
Fantastic. Well, we are out of time. I just want to thank this panel. It's been an extraordinary discussion. I feel very privileged to be able to talk with all of you, given your expertise and leadership in this area. I hope we've done something to
Yes.
raise awareness about this, raise uh, people's understanding that these services are out there. You are not alone, as Casey just said, and please, look into them, make use of them. And just thanks so much to the panel again for giving us your time today and your insights. And thanks everybody for joining.